What? So the Democrats and 15 Rhino Republicans just passed their Medicaid reform bill. They're going to fix everything. We're going to come together, like Tammy Duckworth says, roll up our sleeves, kumbaya, right? Here's what really happened. They have not yet, even in this Medicaid reform bill, we got a TPA now, right? So the TPA is going to say, are you dead yet? Are you dead? Or you're not here, you're not living it, right? It still doesn't ask the one question. Are you an American citizen? Are you an American citizen? The Chicago Tribune decided to commit another random act of journalism. And they knew that Chicago was a sanctuary city where illegals can come and wear their Che Guevara signs and they can't be deported by ICE. So they already knew there was a giant magnet sitting in the city of Chicago. So they said, yeah, I wonder how many on that program are here illegally. Can't be that many, right? Who would like to guess the percentage?
30.
Keep going. Oh, keep going. Keep going. Keep going. 75%. And even under Quinn, there are still 77,000 illegal aliens on our Illinois Medicaid system. And because of this, we have American citizens who are truly indigent, who cannot get prescription drugs for their children with special needs right now. Cannot see specialists right now because of what Blago did to Medicaid. And no one's even asking them to get off the plan. So, Barack Obama did the same thing. You see, Blago jacked up the qualifications to get onto welfare and Medicaid. 138% above the federal poverty level for an individual, and 400% for a family of four. What does that mean in dollars and cents? That means a family of four making $90,000 a year can get taxpayer-subsidized health insurance in the new Obamacare exchanges. That's not poor. In fact, the last CBO assessment says that there will be a minimum of 17 million people added to our Medicaid system. Probably closer to 25 million people. Why is that really bad? This is where I get to Medicare. If you're a senior and you voted for Barack Obama's hopes and chains, you should be ashamed of yourself. Because what they have done to Medicare and what they're about to do to Medicaid is one of the most immoral things the government has ever done to its citizenry. Who's heard of Richard Foster? Anybody? Should be a household name. Richard Foster is the chief Medicare actuary. He's as high as you can go in the government's Medicare office. Every year he has to give an actuarial opinion of where our Medicare system is going. He said in his assessment that not only has the president cut $716 billion from Medicare. You see, they like to put those commercials together, our friends on the left, of which I have none. And it's Paul Ryan, and he's pushing grandma, right? Right over the cliff. Democrats, keeping it classy, right? The reality is the person pushing that wheelchair looks more like Alfred E. Newman with a good tan. You see, it's Barack Obama who is pushing that senior off the cliff. No president in U.S. history has cut $716 billion from the Medicare program. And the most offensive thing is that he has cut it to give it to people who have never paid into Medicare. Not a dime, not a plug nickel. And it's worse than that. Foster's assessment, by the year 2020, the Obamacare legislation will cut a total of $4.95 trillion from Medicare. That is ending Medicare as we know it. They have already ended Medicare as we know it with Obamacare. But the worst part of Foster's assessment is that he states unequivocally that the government will reduce the amount that they pay to doctors who take Medicare today to less than what it pays to doctors who take Medicaid. If you're a doctor in Illinois, you haven't been paid by Medicaid for a very long time, and what you are paid is an insult. That is extremely troubling. Why? Remember this. 2005, American Academy of Cardiology did a study to determine the survival rate of people on surgery who are on Medicaid, people who need surgery on private health insurance. The shocking result in 2005, according to the American Academy of Cardiology, is that you are 50% more likely to die after that surgery on Medicaid than you are if you have private health insurance. Why? Doctors aren't being paid, which means you're not getting any follow-up care, right? So as soon as that study came out, big government, oh my God, we can't have our Medicaid system with 50%. Oh, we can't do that. We have to fix that. So we're going to put more big government on it to fix it. Right? Fast forward 4 years, University of Virginia does a follow-up study. In that year, 2009, you're now 97% more likely to die after surgery on Medicaid than you are with private health insurance. And these studies were completed before Obamacare. Before, according to the CBO, we flood that bankrupt, broken system with 17 to 25 million more Americans. You don't have to use hyperbolic statements like Sarah Palin with the death panels. You just have to get a government-sized calculator and run the numbers. If we're flooding the system come 2014 with 70 to 25 million people with a nice new shiny Medicaid card, just because you have a Medicaid card does not mean that you're going to get access to care. Because our doctors are already overburdened and understaffed and underpaid. Our doctors in Illinois are being pulled in 3 directions. One, Medicaid, they don't get paid nothing. Over here, Medicare. Reimbursement ratios are even lower and lower. The president just cut it by $416 billion. You see, $416 billion of the $716 billion was reductions in pay to doctors, hospitals, and home health care clinics. So their Medicare reimbursements are low. That's why the Mayo Clinic, remember in 2009, before Obamacare, no more Medicare. Why? Because the reimbursement ratios already were too low. So they're pulled here with lower and lower Medicare reimbursement ratios, pulled here with Medicaid, treating a ton of free people, and they're being pulled back here. By who? The attorneys. We have no lawsuit reform. We have no tort reform in this state. In fact, that crazy right-wing nutjob, Howard Dean, please tell me you know he's not a right-wing nutjob. Howard Dean told us why we don't have any tort reform in Obamacare. Ready? This is a quote from Howard Dean. We don't have tort reform in Obamacare because we didn't want to piss off the trial lawyers.
He told the truth.
He told the truth. So, our doctors, especially our OB-GYNs, they're just jumping ship. We're going to Indiana, Iowa, Ohio. We're done. We're done. You take those doctors and flood the system with 17 to 25 million more, you're in serious trouble. What about the health insurance industry, Steve? What's going to happen to them? Why is health insurance so expensive? The president always says it's because the evil insurance companies, they want to charge you money and rake you through the coals, right? He never talks about Apple's profit margin, but the insurance industry, right? It is not about evil health insurance companies raking you over the coals. It's about mandates. In 1979, there were a total of 279 mandates nationwide on every health insurance company in this nation. 279. Those mandates were, if you come in our state and you sell health insurance, you better cover cancer. Okay, we'll do that. That makes sense, right? Who would like to guess how many federally imposed mandates we now have on the most regulated industry in America, the health insurance industry? Just throw me a number, sir.
I think it's 4,000.
Almost. Cut it down and then add 316. It's 2,316 mandates. Now, either 2,000 new conditions have evolved since 1979 that are medically necessary, or we're being forced to cover stuff that's not medically necessary. How big is 2,316? It's that big. It's that big. This is why health insurance costs so much money. Let me read you some of these things. Because you think, oh yeah, leukemia should be covered, right? That makes sense. Oh no, here we go. Ready? Hair plugs. Why are we paying for hair plugs? When we paid for Biden's, we got ripped off. Next, health club memberships. Why are we paying for health club memberships? What else? Infertility. You know you pay about 30% more in Illinois for infertility, even if you don't have the proper plumbing below your navel to even have a child? You're going to pay more. And then the worst state, the worst, is California. the land of fruit and nuts. You see, in California, there's about 6 health insurance carriers left. There are 1,300 in this nation. They don't want to sell in California. You know why? All 4 University of California campuses, including UC Berkeley, guess what's a mandated covered expense on their policies?
Birth control.
Oh no, that's a president's obsession. Oh no, it's worse. Coverage to turn your Audi into an innie. And I don't mean your belly
Oh,
button.
you're kidding. What?
Right. Sex change, right. Is that medically necessary? I don't think so, unless you're RuPaul. But everybody has to pay more. So you know what happens? The insurance companies say, bye. We've got 56 other states to do business in if you're Barack Obama, or 49 other if you're a normal person. Right? This is why it's so expensive. Right? And other things, archaic laws, like the McCarran-Ferguson Act of 1945, that prohibits insurers from selling their products in all 50 states. Get rid of it. Get rid of the special preferential treatment you give to business-funded health insurance, employer-sponsored health insurance. They get to write off their whole premium. Self-employed, not even close. Stop it. Stop the crony capitalism, the favoritism between one or the other. Make it the same across the board. Now, the last 2 things that John Roberts gave us, besides the Roberts tax, right, was community rating and guaranteed issue. Both of them will destroy the remaining health insurance companies in this nation within 3 to 5 years. Remember I said that, if we don't stop this. The only ones remaining will become heavily taxpayer subsidized utilities. Here's why. Barack Obama's healthcare law says that you don't have to keep health insurance coverage because that would be tough. Like constantly paying premiums, that's way too much responsibility. So you can wait until you're sick, and then you can buy a plan. And then as soon as your treatment is over for that condition, you can dump the plan and wait till you need more treatment and buy it again on a guaranteed issue basis. You know why HIPAA portability laws work so well? Because when people call me and they lose their job, they're looking for another plan, they're terrified to get past the 63 days. Because they get past the 63 days, what do they got to face? Pre-existing conditions, right? Barack Obama says, you just wait. Just wait. Let me equate that to homeowners insurance. Let's say you've got a beautiful $480,000 home, which was worth $800,000 before Barack Obama, right? And you don't have homeowners insurance on it. And then it burns down, and you call State Farm and say, hi, I'd like a policy to rebuild my pile of ashes, please. It's the same thing. It's actuarially impossible, right? The second is community rating. Now, in order for me to explain community rating to you, you need to sever your skull, because brain is not necessary. You need to think like a liberal, just with this. Because we all know they're big-hearted. Just work with this, that's it. No brain. It's detached now, okay? You're a liberal legislator, you've come into a state, and you start purveying the health insurance industry, and you go, there's some people in this state paying more for health insurance than those people over there. That's not fair.
Yeah.
And it sounds all kind of smart, right? Fair and equitable. So let's just level it all out so all of you are paying the same premium. That's only fair, right? Now you put your skull back on, okay? Because that community rating has failed in all 12 states they tried it in. Here's how it works, right? Everyone's got to pay the same premium now. So now you have the 27-year-old Occupy Wall Street member who has to buy his health insurance plan, right? Because he's passed the failure to launch clause, which is 26, that's what I call it, keeping your kid on to your 26, which by the way you could do for many years before Obamacare. In almost every state, your kids could stay on your plan until 25, 26, 28, 30, for years before Obamacare. So the next time our friends on the left, which I have none, try to use that, tell them that was the law in states for years before. So now you're past the failure to launch clause, you're 27, you gotta go out and buy health insurance. You're an adult now at 27. So you're shopping the market. They know, the insurance industry, you're not gonna have claims for years. You are the young invincible. We need more of you to drive premiums down, right? So you buy it, it costs you about $68 a month, right? You got a good plan. Here come the liberals without their skulls, just their hearts to legislate, right? Everybody's got to pay the same premium. Now, Mr. 27-year-old has to subsidize Mrs. 62-year-old's premium, right? So what happens to Mr. 27-year-old's nice $68 premium? Do you know the definition of a split second? That's how long it takes that 27-year-old to call his insurance company and terminate his coverage. It takes about 5 seconds more to call all his friends and tell them to cancel too, because they're all getting a $100 to $150 increase monthly in their premiums. Then what happens to the risk pool? Risk pool gets smaller with no more young invincibles to lower premiums. What happens to Mrs. 62-year-old? This is not rocket science, but this is what John Roberts let go forward. You take community rating, you take guaranteed issue, and you kiss every carrier goodbye. And you will subsidize the rest of them. Lastly, and I will close with this. Even if you're not working anymore, you're done. You've got a retirement portfolio, right? Hopefully you've invested conservatively, right? You're relying on your dividends from that income. Do you remember when Nostradamus, which is what I call Henry Waxman, when Nostradamus called John Deere and Caterpillar into the House of Representatives for a public hearing because they were sending information over saying, listen, we ran the numbers. You're going to kill us with this law. You're going to kill us. He said, I don't care. I want you in here with cameras. We're going to run the numbers with you. So all John Deere and Caterpillar did was tell their actuaries and their CPAs, just email this idiot with the numbers. So they did. Anybody ever see that congressional hearing? You know why you never saw it? Because they were right. He canceled it. So Lloyd's of London, one of the most respected actuarial firms in the world, said, I wonder if it's just John Deere and Caterpillar. I mean, it is one law that affects everybody, right? Top-down tyrannical government. Maybe it affects other companies. Let's go out and find out. So they decided to interview 80 of the biggest companies in the nation. Here's the list. Let me read to you what Lloyd's of London said. Starting in 2013, companies that provide prescription drug benefits for retirees under Medicare can no longer deduct this subsidy from their taxes due to the President's federal healthcare overhaul, signed into law March 23rd, 2010. Now, I don't want you to tell me what companies are in your retirement portfolios. I just want you to think as I'm running these numbers. Ready? Walgreens, starting January 1st, 2013, will take a $44 million loss. Okay? That's just one of them. Let's continue, shall we? Pfizer, $270 million loss. Granger, $11 million. Norfolk Southern, $27 million. Ecolab, $5 million. Caterpillar, $90 million. Pepsi, $40 million. Boeing, $150 million. PPG Glass, $85 million. United States Steel, $27 million. AT&T, I'll get to them in a minute. Verizon Communications, $970 million. Prepare to pay more for your cell phone coverage if you're with Verizon. Can you hear me now? Ingersoll Rand, $41 million. Lockheed Martin, $96 million. John Deere, $129.5 million. AK Steel, $31 million. Honeywell, $13 million. Exelon, $65 million. Circle back to AT&T, the granddaddy of them all, $1 billion. Do you think that they just might raise the prices of the products that they offer? You think they might lay some people off, adding to the almost 16% unemployment? See, the president doesn't include U6 mean unemployment. Hasn't for years. We haven't had 8% unemployment in this nation for years. The real number is 16%. Think we'll add a few more? I guarantee you that we will, because the numbers I just gave you are first quarter losses only. Now multiply them by 4. So, the reason I put comedy into my speech is so that I don't find you hanging from the rafters. So I'm going to leave you with some good news. The good news is our founders left us an option to stop tyranny like this. It is now up to us to stop this. How do we stop it? You must support SenateConservatives.com. These are our senatorial candidates running across the nation that have been vetted by the great one, Mark Levin himself, and Jim DeMint, amongst others. These are solid candidates. We have 23 Democrats and 10 Republicans up. We can take the Senate, and we don't need 60 seats. We need 50 plus 1. That's it. You see, we're going to use the same bill they used to shove it down our throats, the reconciliation bill, which only requires 50 plus 1. But unlike them, we're going to do it legally. You see, they did it illegally. There were 3 data houses that were very clear before this law passed that the healthcare law will add hundreds of billions of dollars to our deficit. If you read the reconciliation bill, it's very clear right in the 2nd chapter. You must not use this bill if you are going to add a dime to the deficit. It must be deficit neutral or reduce the deficit. They used that bill knowing that it would add hundreds of billions of dollars to our deficit. That in itself is tyranny, without one Republican vote. And lastly, my friends, we cannot get rid of Obamacare without getting rid of the worst part, the Obama. Thank you for listening.
Steve has agreed to field any questions if anybody has any quick questions for him.
Yes, I'll take questions.
Dick?
First of all, 2 things.
Yes,
First, I
sir.
was very upset with people on the other side of the room who didn't know who Richard Foster was.
We know who he is. We know who he is.
Okay. Second thing is you said the president was the first president who didn't know the meaning of a word. He's the second. There's a guy that hit prop with the word is.
That's right.
Oh, yes, yes, like Willie Clinton. Yes. Don't get me started on that. Are there kids in the room? Yes, sir.
I think that a lot of people on the right are very
Yes,
quick to-
let's ignore the 10th Amendment again. Yes, yes. Thompson, sold.
Who are they going to put in it?
Yes.
Oh, what?
Yeah, right, me, exactly.
I don't think you can see it.
SenateConservatives.com. We have to support those candidates. We don't need a ton of them. There's 8 key candidates we want to support. Yes, ma'am?
I received an email and I forwarded it to Terry, and it was saying that the Medicare insurance premiums for future people from Blue Cross Blue Shield from 2012 of $104
Yeah, it's erroneous.
It's erroneous?
It's erroneous, yes. So is the microchip implants. It's not in there. And I want you all to understand, I hope nobody left, because I want you to understand, I forgot the 5th lie, my fault. The 5th lie is what they're using right now. They're demonizing Paul Ryan, saying he's going to end Medicare as we know it. I want you to understand, when they say the word voucher, right, because Debbie was a man, Sergeant Schultz, she's out there everywhere saying, I did say was a man, Sergeant Schultz. That's right, you can use that. She's saying that they're going to end Medicare as we know it. It's going to cost $6,400 more a year for seniors, and they're using vouchers. Some of these idiots are saying coupons. None of that exists. It's a lie. That was considered in the Ryan Rivlin plan. The new plan is the Ryan Wyden plan. It is a bipartisan plan devised by a far-left liberal from Oregon named Senator Ron Wyden and our own Paul Ryan. They came together, they devised a plan that will save Medicare for future generations. How does it work? No one can hate Paul Ryan's Medicare plan and love Obamacare, because it's a contradiction in terms. Because both plans achieve the same goal by using the same vehicle: federally run, taxpayer subsidized health insurance exchanges. If you are under 55 today, come 2016, Paul Ryan and Ron Wyden offer you an option instead of traditional Medicare. They do not take traditional Medicare away. Traditional Medicare is still available to you. But if you want to, you can purchase Medicare health insurance in the new Paul Ryan Medicare exchanges. Okay? You will be guaranteed the 2 lowest price plans on that Medicare exchange. Why he's doing that? By the way, if you want to buy up, you want a plan that pays your Part A deductible, you want better benefits, you can buy up. But you're guaranteed, regardless of income, the 2 lowest price plans. The reason he's doing that is because he has to do it, The 2012 CMS report, Centers for Medicare and Medicaid Services, the latest assessment says in 4 years from today, Medicare's done. Bankrupt, kaput, in 4 years from today. President sits out there on the stump and says, well, I'm going to keep it till 2023, so vote for me. The only way he keeps it till 2023 is by cutting $716 billion from Medicare. That's how he did it.
That's already broke.
That's already gone. By the way, did anybody know? Anybody know this? 136 billion of the 716 billion was the death of Medicare Advantage, which is the most popular Medicare program in the nation with 4 million seniors on it. They love it because it includes Part D. It's officially called Part C. That was scheduled to be terminated, decimated, on October 2012, this month. Now, the President's advisor came to him and said, Mr. President, if you kill Medicare Advantage, there's 4 million seniors who also vote. You better fix this. So you know what he did all by himself? Another executive order. He took $8 billion from an Obamacare research fund, just transferred it, and put off the death of Medicare Advantage until 2013. Who knew that? Just a handful of people. This should be public knowledge. If Paul Ryan does not win with Mitt Romney, you can kiss Medicare Advantage goodbye. The president is making no plans to save Medicare other than cutting reimbursement ratios to doctors, which means you will get to see what? Less what? Doctors. Next question. Yes, sir.
You mentioned Occupy Wall Street. And
Yes.
Within your speech, I do think that a lot of people and politicians on the right have been very quick to dismiss it. I think that maybe if more Tea Partiers actually participated in that movement, then maybe Occupy Wall Street as a whole wouldn't have leaned so much to the left and towards Obama.
Good point. I just debated Occupy Chicago, the 4 leaders of Occupy Chicago, Micah, and I forget the other 3 names, for 18 journalists at the Hilton Garden Inn. This is just last week. And I will tell you that we share certain things with Occupy Chicago, or Occupy the movement. We're upset with crony capitalism, right? We agree with that. There are several things we agree on. It's the solution that we disagree upon, okay? They want what they would describe to us and the journalists, a horizontal democracy. They are pro-democracy. Here's the problem with democracy, okay? We don't live in a democracy. We live in a representative constitutional republic. The problem with a democracy, and I could not get it through these 4 gentlemen's heads, I tried to explain the best I could. I said, me and the 11 journalists on this side of this conference table decide we don't like you, Micah. So we're going to take all your stuff and we're going to string you up by a rope, right? And we can do it because there's enough of us. We are the majority. We are a democracy. He goes, okay. And he goes, go on. I said, if there is no judicial branch, if there is no one there to come in and protect you against the majority, then they will be able to do just that, which is why we have a representative republic, so that we have a judicial branch that can stop the majority from hanging up from the tree. The other problem I have with Occupy, and I asked all 4 of these guys this, and they wouldn't answer until the 3rd time I pressed them. Do you support the violence that your movement has perpetrated on cities all over this nation? The rapes, the destruction of private property, the $21 million it took the taxpayers to clean out Zuccotti Park. And before I asked them that question, the reason I asked it is because they were saying, the tyrannical police in New York, they destroyed our private property in Zuccotti Park. Such violence, they said, it's just horrible violence. So I asked him, do you support the violence that you perpetrated on Zuccotti Park? This is what he said, I swear on my children's lives. This is a direct quote. We do not consider violence, destruction of private property, to be violence. That's the quote. We do not consider destruction of private property to be violence. Violence would be if I reach across this table and punched you in the face. That's a quote. And every one of the journalists were like, whoa. And you know what I said? Thank you for proving that what Andrew Breitbart said was the truth. They are about destruction of private property, destruction of our current form of government, and replacing it with something they have no idea what it even is. So those were our problems. We disagree on the solution. We agree on some of the problems. Anyone else? Yes, sir.
Why do you think we haven't heard more specifics like what you gave tonight? You know, like even with the debate tomorrow night and stuff, are we gonna hear specifics like that, or?